My grandfather had Parkinson's disease. He slipped on the curb and hit his head, and at age 95, he was sent 50 miles away from home to a neurosurgeon for a craniotomy, only so that he could lay in an intensive care bed for a week and then die of pneumonia.
We have ways of prolonging life that may not guarantee quality of life. And those ways can be very invasive, they can be very expensive, they can involve procedures that aren't comfortable to a patient.
And so when somebody's life has been extended but the quality of their life has been severely diminished, that I think creates sometimes regrets.
It should be beautiful and peaceful, not dramatic and traumatic.
You have got to have that conversation and make sure people understand your wishes.
We want to do everything possible to do what the person would do if they could speak for themselves.
It's a hard thing to bring up, it's a hard thing to talk about, and it's also very worthwhile, because when that situation does happen, it can be very comforting to family members to know that their loved ones' preferences are being honored.
It was a very harmonious, wonderful experience because, in my mind, she had everything in place.
One of the most important decisions that you'll be asked to make in looking at advanced care planning and end-of-life care is called code status.
When it comes to code status, we're talking about the moment of passing. Nothing leading up to that moment. We're just talking about the moment of passing and how you would want to be cared for at that moment.
Code status is making a decision about at end of life, when your heart stops and you stop breathing, do you want to be resuscitated?
The benefits is that yes, we might be able to restart someone's heart. And there are younger, healthy, older adults who do survive cardiac arrest. And that is an important part to talk to your patients about. There are very few older, frail adults with multiple chronic conditions who survive CPR.
If anyone has actually ever seen a resuscitation, it's not how it looks on TV.
Very traumatic experience that your loved one's going to go through, that you're going to go through.
If the best things we have to offer are not going to be sufficient, or worse yet, they're going to be harmful.
Those interventions we do during CPR aren't going to reverse all of those chronic conditions that led up to this decompensation that has occurred.
The time that someone goes without their heart beating for itself can lead to neurologic injury that can be permanent.
Most of the time we have no idea whether you've been gone 2 minutes, 20 minutes, an hour, we don't know.
If you don't respond very quickly, which is often the case, end up needing a tracheostomy, dialysis, a feeding tube.
And so heroic efforts are to prolong life at all costs, essentially.
We can do everything to keep them alive, hooked up to machines in intensive care, and that can last a long, long time.
Not doing CPR is definitely an option.
There are alternative pathways on how we take care of you at the end of your life.
And so those include what we call comfort measures. Comfort measures are attending to a patient who may be very close to the end of life.
A do not resuscitate does not mean if you're choking, we're going to be doing the Heimlich, we're going to try to save you. If you just go unresponsive, we're going to try to, take care of you. We're still going to be treating you.
Maybe they don't understand exactly what the DNR is, and they think that if they choose that, they're just giving up on their loved one.
They are kept comfortable. They are given basic medicines to keep them from feeling pain or feeling a hunger for air. These sorts of things that can happen at the end of life.
With empathy, with care, with compassion, to relieve pain, to relieve anxiety, to relieve nausea.
And it also allows for family members to come around and be with the patient in those final moments.
A do not resuscitate doesn't mean that we're just gonna, let you go. It just means once you're already gone, then we're going to allow that to be.
Somebody comes into the hospital and they are unable to make their decisions any longer. So the hospital team looks for an advance directive, and there is none, and they've never had a conversation with their family.
What I remind them is if they don't make a decision, if they don't tell us what their plans are, What they're doing is letting somebody else make their plans for them.
And when caregivers don't have any direction from you as the patient, they're really obligated to do everything possible to maintain your life.
Then the default is to get full code, full treatment, really almost regardless of the circumstances.
And if you survive, your chances being less than 1%, but still if you survive, then you start down a cascade of events.
So when a person is starting to think about their preferences for end-of-life care, their preferences for code status, the best place to start is to have a conversation with a doctor who knows you best.
Because it's much better to do it at that point than it is to do it when they're in dire straits, in emergency type scenario.
Just as important is the conversation that people have with their family members afterwards, particularly the person who you would want to help make decisions, medical decisions for you if you weren't able to make them yourself.
Your doctor, the healthcare team, every single member of your family.
Bring it up at family gatherings, whether it be at Christmas, Thanksgiving, Easter, graduations, other times that families are together.
Write it down and tell us who you want us to speak with, so that when we're making those decisions at end of life, we're making an informed decision.
We have pre-printed resources to help guide people through the decision-making process.
Any point in time you decide to change your mind, we can have this conversation again.
And if you're asked to help and to listen to someone about how they want to leave this earth, what a wonderful experience is how I view that.
So by having the conversation, hopefully we can at least inform people, make them aware, because you're very important to us and we want to know what makes the most sense to you when the end is near.